Well, wonderful. I am Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakana, and I am so excited, one of the co-founders as well. I'm so excited to welcome all of our guests, all of our business partners to the Doctor's Edition. Now, the Doctor's Edition is led by our Medical Advisory Board. Very honored that we have such an esteemed group of healthcare professionals that saw it fit to be a part of our medical advisory board. These members comprise of fields that include internal medicine, OB-GYN. We also have family practitioners, adult and child psychiatrists, dentists, chiropractors, clinical psychologists, as well as licensed clinical social workers and nurses. So we are really excited to bring content and knowledge during our conferences and during our Zoom webinars. I'm Dr. Rita McGuire, so if you joined a little late, I'm a obstetrician gynecologist. In fact, I've been practicing for over 30 years. I trained at Wayne State School of Medicine in Detroit, Michigan. I completed my residency at Cook County, right here in Chicago. I'm the CEO of RJM Wellness and Ripped Rita Fitness. I'm a global women's health and wellness speaker, as well as a member for Doctors for Cannabis Regulation. And again, I'm one of the co-founders here at Wakana, as well as the Chief Medical Officer. So tonight we're going to be talking about CBD, and truly CBD is the rage amongst many patients, friends, family members, but for healthcare professionals, it really is an uncharted territory, just because you'll learn later on in medical school, we're just not taught about how cannabis works in the body. We're not taught about the different methods of consuming CBD or cannabis. So many healthcare professionals are what? They're thumbs down. They're absolutely not wanting to hear about the medicinal benefits that this plant can offer. And again, it's because we're not taught about cannabis, the endocannabinoid system, how it works, drug-drug interactions, dosing, none of that we learn in medical school. So this is an exciting platform to invite healthcare professionals, lay people, so that they can have a better understanding. You know, it's really Dr. Sanjay Gupta who came out in 2014 and made a public apology. He said that we, as healthcare professionals, he said myself specifically, I didn't dig deep enough in the research. I didn't look at all of the science that was going on all over the world. I didn't talk to enough patients. I didn't talk to enough scientists and experts about how this plant can give us back our health in a holistic, organic way. And so when he came out, Dr. Sanjay Gupta made this public apology. This is really when CBD and cannabis became mainstream. So let's look at the plant, because one thing I want to make sure that you're clear is that tonight we're not talking about marijuana. There is a clear difference between hemp, CBD, and marijuana. See, the plant has one side, which is a marijuana side, that gives you the high, the euphoria. And it gives you that high because it has high levels of THC, or delta 9 THC. On the other hand, hemp, which is the other species of the cannabis plant, doesn't give you a high. In fact, it gives you the health benefits without the high because it has very trace amounts of delta 9 THC. So yes, CBD can come from marijuana. and it can come from hemp, but the definition of hemp is classified as containing 0.3% or less of delta-9 THC. This is what makes it legal. This is what the government has deemed to be the definition. And as long as that product is sourced from hemp and contains less than 0.3% of delta-9 THC, it is legal to be consumed, sold, and cultivated in all 50 states. So again, when we look at the difference between CBD and THC, CBD sourced from hemp has low levels of THC, 0.3% or less. It is non-psychoactive, meaning it doesn't give you a high. And in addition to medicinal benefits of CBD, it has industrial benefits. So we're seeing clothes being made from hemp. We're seeing a lot of body care products, shampoos and lotions and salves. But on the other hand, THC, or delta-9 THC, when it is in high levels, when it's higher than 0.3%, then we're talking about marijuana. We're talking about a psychoactive product. We're talking about a product that you can go into a medical or a recreational dispensary and purchase. But again, it will give you that high or that euphoria. So let's look at CBD, because CBD, or cannabidiol, has a very long list of medicinal properties, and that's really what we're looking for. We're looking for another tool that we can use even if we're on medication, even if we're on high blood pressure medication or diabetes, medications for diabetes. CBD can be used in addition to be a tool to help reduce the amount of medication we may be on, or to even replace the medication that we may be on. And we see that CBD has a long list of medicinal properties. I mean, it's an antibacterial. And because of that, we're seeing CBD being used in lotions and hair care to address acne and other bacterial infections that can affect the face and the skin. It also inhibits cancer cell growth. It's neuroprotective. It can protect and repair damaged nerves. It also reduces seizures and convulsions. It helps to reduce arterial blockage and inflammation. It's a very powerful and potent analgesic. So instead of taking opioids like Vicodin or non-steroidals like Motrin or Aleve, CBD can be a very effective pain reliever. It also helps to relieve anxiety and depression. It's a vasorelaxant, so it improves blood flow in vessels that have been narrowed due to arterial blockage. So CBD, along with the other compounds that the plant makes, and you see them here, like CBG and CBC. There's over 118 different compounds that the hemp plant makes. But when CBD combines with these major players, absolutely it has a very profound result that many of our looking for, many that our patients, our family, our friends are looking for, just to aid in sleep, or maybe to aid in anxiety or panic attacks, or maybe they're looking for something that can aid in hair growth and hair restoration. So it is CBD that is the hero when it comes to cannabinoids and giving our body what it needs, giving our body balance. So when CBD was legalized in 2018, or the hemp species was legalized in 2018, a pharmaceutical company called GW Pharmaceuticals, I'm telling you, they hopped on getting a product FDA approved. And this is the only CBD prescription that is approved by the FDA. It's called Epidolax. And I bring this up because you see the pharmaceutical companies understand the benefits, the medicinal benefits of the cannabis plant. So what they did is that they went into a lab and they genetically constructed from a plant, a hemp plant, a CBD prescription medication for children who have seizure disorders. So Epidolax is the first and only FDA-approved prescription. This is a CBD product that is a synthetic product that is used for children who have seizures. So yes, CBD is legal in all 50 states. It was legalized in 2018 after years of hemp being a Schedule I drug. It no longer is a Schedule I drug and is legal. Again, as long as it is coming and sourced from the hemp species, as long as it contains 0.3% or less of Delta-9 THC. So why are Americans using CBD products? Well, first we're going to talk about the fact that 14% of the total US population, adults, are using CBD. You know, mostly we're seeing CBD usage in the millennials as well as baby boomers, but overall there's a higher percent in younger people. The West Coast is the region that uses most CBD. This is growing worldwide, again, because CBD is mainstream. Now, some of the top reasons that we use CBD, or our patients or our friends, or maybe even you that are on this webinar and hearing it for the first time, well, just know that the number one reason that people seek to use CBD is to relax, to reduce stress and anxiety. And then the top next reason is to address pain, to relieve pain in the muscles, in joints, and chronic long-term pain. There's also those who want to use CBD for social use, to treat migraines, to offset nausea and vomiting, to help with meditation or spiritual use. There's a novelty. So there's that novice that wants to see what CBD is all about. There's also a lot of Americans that are using CBD for skincare, for their facial serums, for lotions, for salves, or body creams, and then for menstrual relief. A lot of my patients, instead of using Motrin and Aleve for their menstrual cramps, or maybe they have endometriosis, they have very painful discomfort during that time of the month. And sexual enhancement is another reason why people use CBD, to spice up that sexual time in the bedroom, to offset vaginal dryness in postmenopausal and menopausal women, and of course, to treat seizures. So there's a large differentiation of reasons why people use CBD, but just know the number one reason, or the top three, is for relaxation, stress and anxiety relief, improvement in sleep, and for pain. So when we look at using CBD, we have to be conscious of the fact that many of you may be on medications. Many of our patients, if you're a healthcare professional on the line, use medications. So we have to understand the way CBD is metabolized and its potential for a drug-drug interaction. So when we think about the way CBD can affect medication you're on, well, one way it can affect, it can inhibit or reduce the effectiveness of maybe your metformin or your lisinopril. It can also potentiate the effect of your medication. Maybe you're on a medication for depression like Prozac, or maybe Xanax for anxiety. CBD can potentially cause that medication to work even more in your bloodstream. Because CBD is metabolized in the liver, and so many of these medications are metabolized in the liver, it's important to know that when you're using your pharmaceutical medication, that you don't use a CBD at the same time, that you consult with your physician before using CBD, that you space that between 1 to 2 hours after taking your prescribed medication. And then another concern is drug testing. Does CBD show up in a drug test, right? That's always a big concern when people understand that CBD is sourced from the cannabis plant, but it's sourced from the hemp species, right? It's the species that contains 0.3% or less of delta 9 THC. Well, there's been a lot of studies and data that show that if you're using CBD in a topical way, if you're rubbing it on your skin, if you're getting a massage, if you're putting a lotion or a facial serum on your face, or if you're putting a topical on your achy joint or muscle, it will not pass the blood-brain barrier. The only way that that particular product can cause a drug screen to be positive is if you inadvertently consume or ate that product. So please don't eat any topical products because they're not for internal consumption, but just know that topical products do not pass the blood-brain barrier. What they did notice is that if you have a high amount of CBD, if you're taking large doses, like 1,000 to 2,000 milligrams a day, which is a lot of CBD, the average dose of CBD for most people is between 20 and maybe 50 milligrams a day, not 1,000, not 2,000 milligrams. So there was a source that cited that at high doses, there's a chance, there's 11 to 23% chance of detecting a THC positive result in a drug screen. So that's why we have products like isolates and broad spectrum products that have THC removed that are safe and effective for those who have urine drug screens. Another thing that you need to understand is that these urine drug screens that are out in the market, like if you go to Walgreens or CVS, the sensitivity and specificity is not very great on these tests, meaning that they can cause a false positive result. And the reason why they can cause a false positive result is that when they detect any cannabinoid, they will detect it and read it as THC. This cannabinoid could be CBC or CBG or CBN or CBD, but because these urine drug screens are not very sensitive or specific for THC, they could cause a false positive result. This is why one of the labs, which is LabCorp, let's see where that slide is. Let's see where that slide, I'm missing a slide. Here it is. That's why LabCorp has a very sensitive urine drug screen. It is a drug screen that has a very high positive predictive value. And this is probably the lab that you want to use if you have urine drug screens at your job. It's LabCorp. And it's a very sensitive test that will not give you a false positive reading. So that's something for healthcare professionals to know when they're testing their patients in their office, that they should use the LabCorp testing. So what are some of the things that you should know? 5 very major things you should know before buying a hemp-derived CBD oil, right? Because there's CBD everywhere. There's CBD at the gas station, the smoke shops, the video stores, and it's important to get a product and a brand that you trust, one that you understand that it's been grown organically, one that you understand that it's a very clean extraction method. That's the way we get the oil out of the plant, and the fact that third-party testing should be done on these products, right? So not all CBD is made equally, and absolutely, you don't want to risk taking any CBD product that does not have these 5 very major components going on. So when we talk about our products here at Wakana, our products are quality products, they are very potent products, and they are products that have been grown organically. Our products are sourced from organic farms in Oregon and Colorado. You know, hemp thrives at very warm temperatures. A lot of hemp is grown indoors in those areas where it does get cold, in areas where the soil is drained well. You know, the filtration and hydration system is very important, as well as the lighting to have quality crops. And again, less water is better than more. A lot of crops here in the Midwest last year, because of all the rain, had to be discarded. So making sure that you understand that that hemp needs to be grown organically to have a high quality product. And then the way the CBD oil is extracted. How is it extracted from the biomass or the plant? Well, the cleanest way of doing it is through a supercritical CO2 extraction method. And that's the way our products are extracted. This is a very clean product extraction where the CO2 is not left behind or as a residual solvent. It is a product or a process where it reveals high quality product in the long run. It's a very pure product in the long run. Though it's an expensive way of extraction, it is the cleanest, safest, and purest way of extracting CBD. And then third-party testing. Not only are our products grown organically, not only are our products extracted in a very pure way by a supercritical CO2 extraction method, but our products are third-party validated testing. All of our products come with a certificate of analysis. All of our products go through another testing to ensure the potency, to ensure the quality, to ensure there's no mold, mildew, pesticides, heavy metals, residual solvents, bacteria. All of these components, if they are found in the CBD product, can absolutely make you sick. So this is why it's critical that even though the FDA doesn't mandate CBD products be tested, it's critical that you are using products from a reputable company like Wakana, products that are tested, products that are grown organically, and products that are extracted in a safe manner. So how does CBD work? How do these cannabinoids that are coming from the hemp plant and even coming from the marijuana species, how do they work in the body? Well, they work by a science called the human endocannabinoid system, in such that when you consume CBD, they bind to receptors that are found throughout your entire body, major organs and glands like your lungs, your liver, your kidney, your bowel, your stomach, your skin, your teeth, your eyes. All of these receptors, when CBD binds to them, they put the body back in balance. They do it by sending signals to different pathways to reduce pain and inflammation, or they send a signal to different pathways to reduce anxiety by releasing more dopamine and serotonin in the bloodstream. There's a real science behind how CBD works in the body. So the main receptors are CB1 and CB2. In fact, there are 100 different receptors and pathways that have been identified now in this human endocannabinoid system. But just know that when we consume CBD, not only does it put the body back in balance, but it's a vital regulatory system that gives our body what it needs. It gives the body sleep if it needs sleep. It gives the body energy if it needs energy. It gives the body less anxiety if it's stressed or anxious. So it's very, very scientifically sound and proven. In fact, our body makes the same cannabinoids that the plant makes. Our body makes anandamide and 2-AG. And when these two very major cannabinoids or endogenous cannabinoids are deficient, this is another reason why everyone needs CBD, because these two, when they become deficient, can cause disease, can cause migraines, can cause fibromyalgia, can cause depression, can cause a lot of the illnesses that we see today. So there's different ways of consuming CBD, and this is what I love. There's something for everyone. You know, you may be someone who likes tea or coffee, like I'm drinking tea now, and you may want to just infuse your tea with CBD. Well, that's a water-soluble product. Or there are edibles, there are gummies. There's also products called tinctures that you place underneath the tongue. There's products that are in capsules that you can swallow. There's topicals that you can rub on the skin. So there are different ways of consuming and using CBD. But what's important is that you understand that the science that we talked about is documented. In fact, when I'm doing a lot of my reading and research, I use PubMed. And you can use PubMed yourself, or you can use just the internet when you're looking for more information on CBD. And maybe I had a question today about ulcerative colitis. What is CBD's role in GI disorders like Crohn's or ulcerative colitis? Well, it can come in and reduce inflammation. It can come in and be an analgesic or a pain reliever. It can come in and bind to those receptors so the intestinal tract doesn't contract and cause discomfort. The same holds true for those who may be undergoing cancer treatment, reducing nausea and vomiting, as well as being a real therapeutic option for those who are undergoing cancer therapy. Instead of using a lot of those pharmaceutical medications for nausea and vomiting, we can use CBD instead. The same holds true for anxiety disorders. When we talk about anxiety, you know, we're using a lot of Xanax, we're using a lot of Lexapro or Effexor, or we're using a lot of Prozac for depression. We can absolutely use CBD as another tool to help reduce the amount of those medications that someone has to take. Difficult to treat pain. You know, I talked to a person this morning. This woman has trigeminal neuralgia. She said this is the worst pain ever she could even imagine in life. It affects that facial nerve where she has pain all the way from her ear, all the way down to her tongue. She has tried every single thing, every single pharmaceutical medication, injection they have put her on. And what she tried was just a little bit of our topical, just a little bit of CBD topical relieved this woman's pain. So even the most difficult to treat pain, we can use CBD. So what we want to offer you is just a quick snippet of our product line here at Wakana. Again, we offer products in every way of consuming CBD. And again, note that the FDA does not approve of any of these statements. Again, the only FDA CBD drug that's available is Epidolax, right? If you're on medication, if you're under a doctor's care, please consult with your physician before using CBD. But again, we can't make any claims that CBD or our products can cure, mitigate, or even we can't make any diagnosis, but we can share the science, which I just shared with you a moment ago. So we have tinctures, we have products you place underneath the tongues. And what I love about tinctures is that they are able to get into the bloodstream and really start to give you some effect of relief within 15 to 20 minutes. We have two lines. We have one that's a full spectrum line, our power line, has the legal limit of THC, and we have the pure line or the broad spectrum line that has less than 0.0% of THC. So if you have urine drug screens, you'll use pure. If you don't have urine drug screens, you can use any of our power tinctures. We have that water soluble. That's the one I put in my tea. Again, some people don't like putting the tincture underneath their tongue. They may not like the taste. So we have a water soluble that you can easily put in your food, in your liquids, etc. So here are some of the tincture benefits because we have enhanced our CBD products with tinctures, with essential oils like black seed and turmeric and peppermint. These essential oils, along with the CBD benefits, even more improve your condition or challenge that you're looking for some improvement. It helps to reduce, again, inflammation. It helps to improve digestion, improve blood sugar levels, cholesterol levels, hair growth. We see a very many medicinal benefits just from turmeric alone. And then you add the black seed and CBD, it really becomes a very powerful statement on our health. Topicals offer local relief. Any of the topicals can be used safely, even if you have urine drug screens. We have our Extreme Power Relief Cream. That's our #1 seller. This is something that the woman used with trigeminal neuralgia, right on her area of discomfort. We also have Dr. Rita's Rub. It comes not in a salve cream, but it comes in a liquid roller ball. We have a lotion, a body cream that addresses skin conditions or concerns like psoriasis, acne, and eczema. And a lot of topicals have other benefits. It offers fast relief. So as that tincture is working and taking 15 to 20 minutes to get into the bloodstream, you absolutely can apply a topical to offer relief within 1 to 5 minutes. And then our edibles. Our edibles are really a great way to address those same issues in a different form of consuming. Edibles like gummies are great to address insomnia, to address anxiety, to address inflammation and pain, along with our flat belly brew and our flat belly gummies that address those who want to lose weight. CBD can turn that white fat into brown fat. That fat that increases the metabolism, that fat that really helps us to reduce our weight. And then again, the benefits of edibles, though they take about 30 to 90 minutes sometimes to get into the bloodstream, it's great to have that edible as that tincture is working, as that topical is working, and within 30 to 60, 90 minutes, that edible kicks in. So you always have a steady state of CBD in your system. And then our essential oils, again, are another way that you can address your health and wellness in a organic, holistic way. Our black seed oil, again, is something that I recommend to every diabetic, every hypertensive, anyone that has allergies. I add the addition of the First Defense, that's our CBD nasal spray, again, offering the areas where microbes and viruses enter the body, a way to really addressing and reducing the number of viral and bacterial infecting our host. I love the peppermint spray. Peppermint gives me energy. So every morning I'll take the peppermint spray, rub the soles of my feet because the soles of our feet have the largest pores. So just a great natural way of getting energy instead of drinking those Red Bull energy drinks. A lot of the essential oils really do address insects, spiders, any thing crawling around that you don't want crawling around, you can lay out some essential oils as well. Eucalyptus is great to help, again, provide that relief for any congestion, helps to open up your lungs, even if you have asthma or that common cold or flu. So when we move to our smokables are great, great products that work fast. Within 1 to 5 minutes of taking 1 or 3 pulls on our vape cartridge or our CBD pre-roll or our Delta 8 pre-roll, or using the premium flower and rolling your own joint, or using our Delta 8 cartridge or our Delta 8 pre-roll. All of these smokables work quickly. So when you have an acute situation and you really want to address that very quickly, using a smokable will get into the bloodstream much quicker than using the tincture or the edible. So I love having a smokable on hand for those situations that you need to have those products work very quickly. In addition to working quickly, when you vape or you use a pre-roll, it increases the bioavailability. So there's more CBD that is available to the bloodstream versus the amount of CBD that's available after you use a tincture. We have edibles that you can use in the kitchen. We have spices. We have our vegan butter. We have our Culinary Plus. I'm super excited because we're going to have a Delta 8 culinary oil for the holidays. So these are products that you can use in another form of consuming CBD with benefits of reducing inflammation, reducing pain, just spicing up your recipes at home. Our hair care system is really, really quite important. You know, now that we're seeing a lot of COVID survivors, a lot of COVID survivors have something called long haulers syndrome. And one of the long hauler syndrome is hair loss because of the immune response. It's a hyperimmune response. When you get COVID infection, it does affect the hair follicle. So we have a lot of people that have lost their hair that are looking for a solution for their hair to come back. Our shampoo, our detangler, our conditioner, our styling cream, even we have a product for men and their beards, have infused CBD to help get that follicle back. Again, a lot of benefits for not only those who have suffered from COVID, but those who have autoimmune conditions like lupus. They have a real issue with hair loss. Even those who have hairstyles that have put stress and traction on the hair can benefit from our hair products. And then our sanitation products. Again, our sanitation products are products that were offered during the beginning of this global pandemic, because not only do we have to keep our host and our body healthy, but we have to keep our surrounding, our homes, our offices. So these products use quaternary ammonium, which is a CDC approved chemical that can be used safely for your home, for your office. Our produce wash for your food, for your veggies as well. Our sexual health products. Again, our topical products don't pass through the blood-brain barrier. So we have our CBD lube, we have our sensual body butters that are used to increase or improve libido, improve foreplay, as well as our king of the jungle gummies. We have gummies that help to improve stamina, to improve that sexual overall wellness that we all need. So when we talk about the recommended usage of these products, start low and go slow. You don't need a lot of CBD. You don't need 1,000, 2,000 milligrams of CBD a day. Starting with a small dose, 3 drops of our tincture twice a day, starting with half a gummy, using the topical in an area that is needed. If you need more, start with a small amount first. Test it on your skin to ensure there's not a sensitivity to any of the essential oils, and use as directed the spices and the hair care and sanitation products. But the overall goal is to find the dose that works for you, starting low and slow is the best way to get started. So there's so many great choices. You can't go wrong with our products. I do want to just talk about one challenge that one of our business partners emailed me today, and she asked about, how her customer could benefit from CBD that has diverticulitis, and what products would I recommend for that customer. Well, some of the symptoms of diverticulitis, because again, we don't say that this CBD will cure your diverticulitis, but what we can say, it can help to address the symptoms that you may have from diverticulitis. Well, what are some of the symptoms? Well, many of these people have pain during or after eating. They are passing bowel or passing gas. Typically, the pain is on the left side, but occasionally it can be on the right. When the diverticula in the colon here become inflamed and enlarged, it causes this pain. They may see changes in their bowel habits or change in their stool. They can have constipation. They can have diarrhea. They can have blood in the stool. They can have rectal bleeding. They can have nausea and vomiting. They can have more frequent urination or painful urination just from the inflammation of the intestinal tract on the bladder. So how does CBD work in reducing these symptoms? Well, there's a vagus nerve. It's a very important nerve that innervates the intestinal tract. It is a nerve that sends signal from the brain to the gut. See, there's a brain-gut communication. Well, there are receptors. We talked about these receptors, right, on this vagus nerve. And when you consume CBD, it binds to the receptors on this nerve to reduce pain and inflammation. CBD also helps to increase one of those endogenous cannabinoids we talked about, right? Our body produces anandamide and 2-AG. Well, CBD can come in and increase the levels of 2-AG in the bloodstream, which in turn will reduce inflammation, which in turn will cause that pain to be reduced because it's an analgesic, and again, reduces inflammation in the gut. So the products that I would recommend for someone who has diverticulitis is one, the pain cream. Our extreme pain, power pain cream can be applied right to the area of the abdomen that's causing extreme pain. You also want to add, it's called our Trifecta, you also want to add our tincture. So if someone has a urine drug screen at their job, you, instead of using the power tincture, you can use a broad spectrum or the pure tincture. And then, of course, you want to use a gummy. A gummy at night is what's going to help them sleep, to reduce that inflammation and pain so they have a good night's sleep. So the trifecta for diverticulitis would be that topical product, that power extreme pain relief, the tincture, 3 drops twice a day, and the gummy starting with a half or even 1 whole gummy at night. So you can understand that, yes, CBD, we can't say can cure diverticulitis, but we can say can aid and assist in the symptoms that diverticulitis can cause. So that is all for me tonight. I want to thank you for tuning in. If you're a healthcare professional, if you're a lay person, if you're a guest, and even if you are a business partner, if you have additional questions, please email me at ritamd@wakana.com. I am going to take a couple of questions because in 15 minutes, if you want to hear more about the opportunity that we have in becoming a business partner with us at Wakanda. If you want to hear more details about our product line, you want to join us at 8 o'clock. That's in 15 minutes on our business overview. You can get the Zoom ID and the passcode from the person that invited you. But again, feel free to email me any questions, any additional critiques, or anything that you may want to ask me at any time. I'm going to take a couple of questions before we hop on our 8 o'clock call. If there's any questions, you can put them in the chat. If not, contact the person that invited you on this call so that you can get your questions answered, you can get your products ordered, and you can get the Zoom ID for the 8 o'clock call and the password. Wonderful, wonderful. I guess there's no questions here. Thank you, Jewel. If there's no questions, we'll see you on the 8 o'clock call. Thank you again. Be well, be safe, and we will see you at 8 o'clock.